Okay, all right. Well, thank you so much for joining this webinar in which I'm going to show you the CG resources that we've been building to support the COVID-19 vaccination programme. What am I going to cover? I'm going to cover understanding eligibility, using the CG call and recall searches, how to code patient hesitancy and deferrals, understanding the data flows between the systems. This part I might actually need your help on. How well are you doing? Actions that you need to do, ethnicity and the importance of coding. And then at the end, we've got a slide on frequently asked questions that have come up before, but you may also have your own questions, as Keith mentioned. So who is eligible for the COVID-19 programme? Well, as most of you will know, really, the objectives of the immunization programme is to protect those who are at highest risk from serious illness or death. And the Joint Committee of Vaccination and Immunization set out the priority groups for persons at risk. As again, most of you know, it'll be those over age 65 have the highest risk. Risk increases with age. And again, as I'm sure you all know, the residents in the care homes for older adults were disproportionately affected. If we just very quickly go down through them all, though, because there's certain points that I want to pull out. So priority group 1, yeah, residents in care home and also staff working in care home. Priority 2, 80-year-olds and over and frontline health and social care workers. 3, age 75 years and over. 4, 70 years and over, and also those clinically extremely vulnerable individuals, not including anybody under the age of 16. For this group, clinically extremely vulnerable equates to your shielded list, i.e. those patients who are coded as very high risk of severe illness from coronavirus. Then you've got cohort 5, 65 years and over, cohort 6, which are the 16 to 65 years. And these are people who are in an at-risk group. And I'm going to talk a little bit more about these clinical risk groups and the broader disease categories, because I know that there's been some issues over the last few days around this cohort. Then you've got cohort 7, 60, cohort 8, 55 years and over, and cohort 9, the 50 years and over. So issues identifying who is eligible. Well, first of all, you've got the health and social care workers, the frontline health and care workers, who were at high risk of exposure. Again, you might be aware of the coding issues with this group. The coding issue was that there's data errors really in the coding of patients in the practice. So what this meant was that you might have got somebody who had gone off to see the optician, and then the document came back and it got coded as optician. This wasn't in fact the occupation code for that person. What we decided to do, seeing as it's not the practice that is calling in these patients, was that we didn't include this group in our CG recall call searches. This is different to the EMIS suite of searches, actually, who did include this group in. But when we looked in City and Hackney, there were over about 17,000 patients with this code. So we decided not to include that group in. And as I said, it wasn't the responsibility of the practice to be calling them in. It was the employer's responsibility. Another issue that came out was to do with care homes, the care home coding issue. And we did ask practices to look very carefully at the searches around care homes to ensure that patients were coded properly. And if they'd left a care home, that they then needed to be no longer in the care home. This you've got to think about because the searches are mutually exclusive. So if you had somebody who was still coded as in a care home and they weren't, then they wouldn't have been shown up in the later searches. So it was an important job to have got done. Then we looked at cohort 4. As I said, those were 70 plus or clinically extremely vulnerable. Or, as I said, other words is shielded. These group really are easily identified as they've been coded at high risk category for developing complications. Then cohort 6, 16 to 65-year-olds in an at-risk group. This has caused a few more issues. Until very recently, there weren't any business rules to identify the patients in this group, so it was open to interpretation. So what we did in CEG to kind of help the practices was we adopted a Flu Plus model, which was based on the Green Book narrative. Now, there are business rules that have been built by Primus. This happened over the weekend, and then Primus, the clinical systems, EMIS, then adopted these new rules. And so what we have done is we have adopted the new rules from EMIS, and we've amended our Cohort 6 searches to these new rules. What you will see is that this actually includes far less patients than you were seeing if you'd run those Cohort 6 searches last week. I'm going to show you the searches, and I'm also going to highlight the issues around pregnancy and also the issues around asthma when I come to showing you the searches. So how do you know who to call? Well, I'm hoping that all the practices in City and Hackney are using our CEG searches rather than the EMIS searches. And just to flag up again, you'll find them in the practice support folder, and under the first one, which is Zero COVID-19 CEG support. Now I'm going to come out of this and I'm going to go into EMIS. I hope it works, and I'm going to show you the searches and the updated searches as well. Okay, let me just log back in. I'm hoping this doesn't take too much time. I don't know if you practices have been finding that there's been a bit of problem. Oh no, that's quite quick. Great. Okay, so here I'm in EMIS, I'm in our domain, and as I said, our searches are under practice support, then they're under COVID-19 CEG support. You will see that there is a folder here called COVID First Vaccine Core Recall version 8. Version 8 we have just published. And so we would want you now to be using this version. Okay, I'm going to open the folder and I'm going to walk you through what's in the folder. So if you look on the right-hand side, you'll be familiar again with this, and we've got all the cohorts there. So we've got the older adults who are resident in a care home, cohort 1, 2, aged 80-year-old and over. And remember that these are call and recall searches. So of course they'll exclude people who have been vaccinated before, who have declined, who have contraindicated, and they also exclude people who are in a group above. So they're kind of mutually exclusive. What we also put in here was excluding the housebound, because of course you won't be calling them in because they're obviously not coming in. And then we provided for you these lists for AccuBook. There's a little search underneath patients without mobile number recorded, which might help if you were going to phone some people up. But I also understand that you might get stuff coming back from AccuBook, which would indicate if the mobile number isn't working or if the mobile number is incorrect. Cohort 3, the age 75 to 79-year-olds. Cohort 4, these were the 70 to 74s, or people in the clinically extremely vulnerable list. What we were asked to do was we were asked to separate those two groups, which is why you see 4A and 4B. So you can identify your 70 to 74-year-olds, and then you can identify the clinically extremely vulnerable or the high risk. I think this partly was so it would highlight maybe patients who you might needed to have had some further conversation with. Also, just to highlight that this includes everybody who's in the shielding list at that age group, 18 to 69. So it will also include, because this is at very high risk, it'll also include women who are pregnant. Going down, there's also a 4C, and the reason why this has been split is to do with the ages, the 16 to 17-year-olds. Because the 16 to 17-year-olds, the AstraZeneca, the Oxford vaccine, is not licensed for the 16 to 17-year-olds. And so they would need to be called in when you get the Pfizer vaccine. Going down, cohort 5, age 65 to 69. My understanding about cohort 5 is that they are being called in nationally, and that practices have now been asked to focus on the cohort 6. So the cohort 6 were the 18 to 64-year-olds who have got underlying conditions, who are at risk. And I'm going to show you those conditions in a minute. What we've done for this group is that we've excluded, you can see that's the cohort 6, 1864. We've excluded the housebound, as we have above, because of course you wouldn't be calling them in. We've also excluded pregnancy. So for this AccuBook list, they will not show women who are pregnant. That is not because we're excluding women who are pregnant from the actual cohort, but we're excluding them from the list that you would upload to AccuBook. Then if you go a bit further down, you can then see another search will actually identify the people who are pregnant. Now, the reason we've done this was because we were asked by, well, practices and also the kind of Covert group, that actually the patients who are pregnant, who are also in the moderate risk group, may well need to have a conversation with somebody regarding the vaccine. Also, we are also aware that actually coding of pregnancy within practices has a number of issues. For example, you might have somebody who's miscarried and that hasn't been put on the record. So it's also giving you an opportunity to have a little look at these patients and also to make sure that the pregnancy coding is up to date and correct. Going on, that's split again. So that's 6A, aged 18 to 64. And again, we've split because of the 16 to 17-year-olds, because as I mentioned earlier, to do with the Oxford vaccine and the Pfizer vaccination. As we go down, then we're just going down to the other ones, which is group 7, which is 60 to 64, and then 8 and 9. So really the update is to do with the cohort 6. Then you can see as we go down, you've got the moderate risk cohort, which is cohort 6. And we put a couple of searches in there. And we would suggest that you would actually run those searches, so just so that you can actually check who is coming up in those searches. So it's a kind of checking search. If we go down to the next one, the criteria. Cohort 6, the at-risk conditions, Public Health England aligned. If we click into there, you can see the conditions that that have been included. So there's things like chronic heart disease, chronic kidney disease, liver, diabetes, respiratory disease, which I'll come back to, and a host of other conditions. As I said, we've used the Primus business rules and we've based them on the EMIS searches. The one thing that we have added in, which they indicated in the letter actually that was sent out, are patients coded as carers, because if you're getting somebody who's coming for their vaccination and they are at risk and they come with their carer, then the carer could be vaccinated as well. So we have included patients coded as carer in this suite of searches for cohort 6. When I'm talking about the asthma patients, because again, I think you might hear stuff around asthma and patients might ask a little bit about asthma, is that they have tightened up the letter that was sent by the vaccinations committee people. I can't remember who it was from now. Anyway, they've tightened up the definitions for asthma, and they've tightened it up to anyone who has ever had an emergency asthma admission, and then also including those with asthma diagnosis who have had 3 prescriptions for oral steroids over a 3-month period. So we have done exactly what has been indicated, and you will see in the EMIS searches. As I said, this will mean that compared to last week, the numbers in this group will have reduced. I hope that's sort of clear. Okay, what else can I show you in here? Well, in the criteria, you can this suite of searches will just show you who's been coded as contraindicated, coded as declined, coded with adverse reaction, and patients who've received any COVID-19 vaccination dose. This data quality search, at the beginning of the presentation, I mentioned the housebound. So it really is to make sure that the people in this are the correct patients who are housebound. You can also code people who are kind of unwilling and really unable to come to the practice or to the centre for their vaccination as temporarily housebound, so that they will come up this list for somebody to go and visit them. And then, of course, we've got the older care home register, which again I mentioned actually that might need some coding tweaking, which is if you've got people living in the CQC care homes, can you code them please as living in a residential home and living in a nursing home? And if they no longer live in there are codes for no longer lives in nursing home and no longer lives in a residential home. That will then exclude them from that group, and then they'll be included in one of the other groups. The last folder in this little section is to do with invitations. And so that'll give you, if you ran that, you'd be able to see your cohorts from 2 to 4 who have not been coded as being invited yet. You may well have invited them, but they haven't been coded. And I'll show you, we've got a template to help you with that. What practices have also raised as an issue is that they have been sent some data which has come from the performance dashboard that CEG have been producing. They've looked at that, and they've also looked at their call and recall searches, and they've said, but they're not looking the same. And this is because, as I said, the call recall searches are excluding people who have had the vaccination. If you wanted to have a little look at what we're reporting in the dashboard, there's this folder called COVID First Vaccination Uptake Performance Searches. And these, let me just try and make that a little bit bigger there. These will show you your cohorts, and they're broken down, say, for example, like your older adults, and they're broken down into those who've been invited, then vaccinated, declined, allergies or adverse reactions, and contraindicated. So if somebody originally declined and then they got vaccinated, the vaccination would trump the declined. So that is there for you to have a look to see how you're doing. A couple more, just a few more points to make about this is that these are for the, if you're looking at this one again, sorry, for the first vaccination. We are aware, of course, that people will be getting called in for their second vaccination. So we will be producing some searches for you on that group. We will also be producing some searches for you on patients who have declined or deferred. So it might be that, again, you would do a follow-up phone call to see what's happening with those patients. So just to flag up, recall version 8. And we are sending out comms to practices. What we do with our comms is we do send a bulletin. It's kind of a weekly bulletin, although we do send a few things in between if we've got something urgent. But we also liaise with the Confederation, and we also try and put, any urgent COVID stuff. We ask Claire and Amaya and Janet if they can also put that in your Confederation bulletin as well, just so that there's kind of like 2 ways to make sure people are getting the information. Is there anything else I want to mention about that? Let me just look at my notes to see if I've forgotten anything. No, I think I might come back out of EMIS and go back into the presentation. Okay. I think that in City and Hackney, the practices do tend to use our CG searches, but maybe just to flag up why we think or why we want you to be using our CG searches. rather than the EMIS suite. And the first one, I think, is the most important one, is that kind of we've designed it with the needs of kind of our local patients and our kind of local practices in mind. So, for example, with the pregnancy, that was flagged up to us. So we were able to kind of very quickly incorporate that extra search to enable you to be able to look at your pregnant your pregnant ladies outside of the other group. Secondly, well, I mentioned that the occupation data areas, they're in the EMIS searches, but we don't include them. As I said, we haven't excluded pregnant women from the cohort record, but so you can actually, be assured they are in the main cohort, but we've just done the two different pathways, not on AccuBook and the other pathway which I showed you. Yeah, we're producing the CSV files for your AccuBook. And the other point to make, I think, is that we like to think that we're responsive to changing parameters. And as we know, things have been changing quite quickly, and we've worked very hard to get these changes out to you as fast as we could and we can. Okay, just to move slightly on to something different is the managing the hesitancy and people who are deferring vaccinations. As you probably would have seen that at Pinnacle, when somebody declines, you will see a declined code in the patient record. And next to that, you often get some associated text, actually, which will give you some idea of reason for declined. What we've produced, we've produced a new CG template because we're mindful of the fact that you may well also be one, sending letters to the patients, but also you may well be phoning patients up, about using landlines. So if I just show you the template, you should already have this template in your system, and it's called COVAC Invite Follow-up Template. And if I quickly go through this, what we've got through here at the top is we've got the code for when you invite a patient to have the vaccination. Now, what some practices have said is that this invitation code is the SMS text code. And so some have not been particularly keen to use it because it's not truly accurate. What we are saying is that you have to be, we've got to be pragmatic about this because that is the only code that is available at the moment to indicate that you've done invitation. So what we are suggesting is that, let's say, for example, you're sending a letter or you're phoning them up, that you would still tick that box, but then there's the opportunity to put in the text a mode of contact, letter, for example. And then when we produce some searches, you'll be able to look at those patients, you'll be able to look at the associated text, and you'll be able to see what's happened. For the vaccination deferred, if the patient defers to have the vaccination, for example, they might be unwell, they might want it a bit later, they might want to talk to their family. What we are doing here is we're saying code them as declined because they have declined the dose. But again, in reason for deferral, that'll be the associated text. And you might just want to put in their reason for deferral, patient unwell, or whatever patient needs to talk to their family. So we can write you searches to identify. We're also asking you to, once you put that code in, is also to also code treatment delay, patient choice. Because this means that we can do a very simple search just based on that code, which will identify deferrers. Same for the second vaccination. So we've broken that down into first vaccination deferred and second vaccination deferred. And the second slide here I've got, which is it's not a long template, but we've also added a couple more sections. And this is to do with the attempted contact 3 times and no response. So what we've been informed by the NEL COVAC group is that after 3 unsuccessful attempts at contacting a patient, you may record them as declined. They are saying, however, that good practice is that 1 attempt does need to be done by phone. So it wouldn't quite be enough to just send 3 SMS texts and, kind of feel like job's done. And then again, you could code that the first dose has been declined, and why have you coded it as declined? Because you've had an unsuccessful encounter following 3 attempts. So you've got all this recorded in the record, so it's very clear. And with this one, of course, you would have going back to that, you would have coded this, so you would have had 3 instances of an invitation being sent. If you've got a true decliner, somebody who says, I never, ever, ever want to have this vaccine, I don't want anything to do with it, I don't want the course, I don't want anything, you can use this one, immunization course declined. And again, the search will identify those patients just in case, in a month's time, you actually look at that and think, we'll have another go and we'll talk to them and we'll add in some, further encouragement. So that's that template that's available for you. What we also thought would be useful in this presentation is to do a little bit about understanding how the data flows between the systems, just because this can help us understanding how long vaccination data is before it comes into the system and how this kind of affects our reporting and dashboards. So my understanding, or our understanding, is that you've got the vaccination site. Some patients will have their vaccination in hospital, and this is recorded in the NIVS, the National Immunization Vaccination System, NIMS, National Immunization Management System. So it goes through there into the data processing service. That's one way data gets put in. Then we look at this when it's the primary cares, the GP hubs, the pharmacists. That data for the vaccination data is going through Pinnacle, Outcomes for Health. Again, it goes into this data processing service. Then you'll see it in EMIS. We're all EMIS practices in City and Hackney. That seems to take between about 48 hours to appear in your system. I have heard that a couple of weeks ago it was taking up to 72 hours. I don't know if it's still taking that sort of time, but I think it's meant to be in there within about 48 hours. So you can appreciate that if we're running some of our dashboard reports, we'd be not capturing all the patients because, of course, there's a delay with this data coming back into the practice. Then you've got your care home. When you go do the home visits in the care homes, again, you'll probably be clear on how this is recorded. My understanding, it's done manually, paper or spreadsheet. It may well be done on laptops, but again, that would then go into Pinnacle, and then it comes all the way back into EMIS. So really, I think the purpose of this slide is really to demonstrate that there can be the delay. So when you see the dashboard, you might look at that and think, but we know we've vaccinated more, but we have got that delay. Again, just looking at some of the data flows between the systems and invitations, this is slightly harder to know what's going on here, but we know that nationally, people are being invited via SMS and also via letters. You've got in the GP feds or the GP practices where you're getting invitations via Accurix. Those Accurix invitations will be coded with that code I said, the SMS text. But there's been a bit of a delay with things like letters and other phone calls being coded in EMIS. So that's why we've done that cleanup search for you that I showed. And then I don't know so much about this part, actually, whether public health or CCGs or others are calling and how those invitations would go through. But I'm happy to hear from anybody who has any information about that. Okay, how well are you doing? This was just the performance search. Sorry, it says new. I didn't manage to upload it, but you've got the one that I showed you before, which is the performance search, which links to our dashboard. So that's in your CG suite of folders. What sort of things do you need to think about doing now? Really what you need to do is, well, I would say continue to look at that care home register and, make sure that's accurate. Clean that one up. Check your cohort 6. We have just published those searches today, so we would really like you to check your cohort 6. And if you spot anything, please tell us immediately. Get in contact with us. Check if your housebound register up to date. This, I think, is particularly of issue to City and Hackney because, again, a couple of practices contacted me to say the housebound figures didn't relate to the housebound figures they had. When I asked them what they were looking at, they said they were looking at their proactive care home visiting register. But we are not pulling up the code proactive care, on the proactive care home visiting register. We are pulling up the code for housebound. So if you've got people in the proactive care register who aren't coded as housebound, please put the code housebound on those people. I talked about the temporarily housebound earlier on, and I also showed you the invitation code. So if you look at that and think, but we've invited these people, go and put the code in for invitation by using the template. You can do that. Ethnicity recording. This is just really to flag this up actually. So ethnicity recording is now a statutory requirement, and the biggest gaps where we're seeing with patients not having ethnicity recorded is in new registrations and in the under fives. Remember with ethnicity is that it's not something that we do, it's something that a patient would self-report what ethnic group they're in. We are pushing practices again to record ethnicity because this helps us to see what's happening amongst the different groups with uptake of the vaccine. So what we've got just to flag up is that we do have patient alerts. So if somebody hasn't got their ethnicity recorded, you'll get a patient alert. If you double click on that, it'll open up a template very quickly that you can enter it in. If you wanted to have a little look to see, oh, well, what patients in our practice don't have ethnicity recorded, there is in the practice support folder under additional, under 7.0, a search that indicates who hasn't got the ethnicity recorded on their record. So it's just a real push, and a push maybe to flag up to your clinicians that if they see that, it is a quick click and they can record ethnicity if that's been flagged up in the alert. So some of the questions that we've had before, how do we handle the 16 to 17-year-olds who are at risk? We've given you searches now on that, and that's just to flag up that the Oxford vaccine isn't licensed for the 16 to 17-year-olds, so they would need to be called in when the Pfizer vaccine is available. What about pregnant and or breastfeeding women? As I said, with pregnancy, they were included in Cohort 4 and in Cohort 6. We've given you the opportunity to actually have them separated from the AccuBook list. Why does my CCG say my achievement is lower than it is? That, I said, is to do with the dashboards, and as I've shown you kind of how the flow of data comes through, there will be a lag because it's not going into the EMIS for 48 hours or so. Who can I contact if I don't understand the CEG searches? Well, in City in Hackney, it'll be your happy primary care facilitator, Lewis, who will be able to support you with this. Why have I got younger patients vaccinated if I have not called them? Again, I'm guessing that some of the younger patients could have been through their occupation, so they could have, got vaccinated through something somewhere else. How can I record telephone, letter, verbal, email invites? I think I've gone over that. That is the RP COVAC invitation follow-up template. I also just put this slide in. I just wanted to show you so that you know some of the work that we've also been involved, which is also relating to COVID, not so much the COVID vaccination, but just COVID. And on our RP COVID-19 template, that is the kind of catch-all. So if you've got somebody who's got suspected COVID, you can use that template. If you're doing a follow-up review for somebody with COVID, you can do that template. And we've now included pages for post-COVID. You've got your service set up in City in Hackney for patients to attend a post-COVID clinic if they've had post-COVID symptoms for over 12 weeks. There's a referral form, and then it's also now a template which will cover all of the indicators, not indicators, but the fields rather, that are needed for that referral template. Then we've got the oximetry monitoring. You have, again, in City in Hackney, a referral form for your doorstop assessment service and your home oximetry monitoring. You've got the referral form, and now there is a page in the COVID template called oximetry, which will enable you to write a little bit about why you're sending that person there, and then you can text, you can code rather that you've referred them onto that service. We have built F12 key. It's a protocol that attaches to the F12 key, which would launch all our COVID-19 resources. And so you can attach that to your F12 key launch COVID-19 resources. In there, you will see our COVID-19 template, our COVID invitation follow-up template, and then all the letters that are required. If you haven't got this set up, this does need to be set up for each actual individual. It doesn't just get set up on one and then sent out, so each individual would have to set this up. But if people feel it would be useful, again, Lewis could kind of support you with that. That is the end. That is me done. We do have Anna, one of our other facilitators on the line, who maybe might want to come in case I've forgotten something, but also any questions now. So I'm going to stop sharing. There's me. We struggle with this bit. Have I stopped sharing? No, not yet. Here we go. Is that one? That's the one.
Yeah.
Yeah, I'm back. So yes, any questions? Or unless stuff has come up in the chat as well, because I couldn't see the chat as I was going through it.
No, there was one question in the chat which Anna has already answered. Thank you.
Okay. What was that? Just
when the version 8 will be available, which it is already available now. If you don't see it at the moment, guys, you'll just need to log out of EMIS and then log back in again.
Okay. Are there any other questions? Have I answered everything? Claire's got her hand up. Claire?
Hello.
Hi, Claire.
Hello, that was very informative. Thanks, CEG. Please, can we have version 8 at the Confed as well? Just to flag up to people a little bit about AccuBook invites, for those that aren't sure, when we do put our appointments on, say we have 2,000 appointments available, we can only get 4,000 invites uploaded to AccuBook. So it very much is a case of first come, first served for those practices who have run their searches and can upload their CSV files from the CEG searches. So it's really important that everyone continues to manually go through their invites, you know, those without the phone numbers, to phone patients, to cancel invites that aren't needed, because other practices can't upload their searches, those lists to AccuBook. So we are very much depending on practices to keep on top of that. We have sent out an AccuBook guide in the bulletin quite a few times, and if there's anything specific, then please email Tasneem Sardar in our team who can help.
Then we've got Denise. You've got your hand up.
Hi, yes, thanks.
Hiya.
Hi. I was just wanting to find out from Claire and yourself, I'm not sure, you might be able to respond. If practices then had used the previous search, you know, for the cohort 6, the Friday search, and they've sent out, and I think that may have happened, and therefore there will be a lot of invites gone out to patients with asthma who maybe shouldn't have, and therefore some practices who waited a bit and then we were kind of sort of waiting for version 8, as we have been, are a bit stuck then if the AccuBook is full. So I was just wondering, have practices then been told to clear up that message, because maybe half of Hackney have been sent the AccuBook search from the previous version, and I think that may have happened over the last 4 days or so. So I'm just at this moment not sure what's happening now in terms of those invites that's been already sent, because they can't maybe resend those invites. So that was just to flag this up, because I think it's a little bit messy what may have happened over the last few days, unless all practices they haven't done this. They didn't do that, and we were the ones who were just waiting. I don't know if anybody's got any further information on that.
Claire, are you still here, or?
She had to go.
Oh, she had to go. Okay. Denise, this has been flagged up to us actually, just now from another practice about what you know you can do if the invitations have been already sent on AccuBook. To be honest, I'm not sure quite how this process would get managed. I don't know if anyone else has any ideas on how you could manage the AccuBook. Look, Amanda, can you help me on this one?
Well, I mean, funnily enough, we're in the same position as Denise. We ran our searches, but because the appointments weren't available, I haven't been able to upload them, even though I've been sort of trying at regular intervals. So, I mean, luckily, I can kind of scratch the searches that we've done, and I'm just running the version 8 now. So we're going to be sort of working with a clean list. But I guess the only way that it could be done off the top of my head would be to actually run a search to identify the patients that have been included with asthma that probably shouldn't have been, and then to actually manually go in and cancel those appointments if they've not been taken up by the patients. But it's quite a lot of work involved with that, but that's the only way I can think of doing it.
Okay, thanks, Amanda. Sonia, you've got your hand up.
Hi, yeah, I just wanted to say we've made a mistake like that before regarding a wrong upload. So I had to contact Accurate, and then I had a web chat with them, and they were able to cancel the claims instead of you having to do it manually. That helps. So they can do it in bulk rather than any practice having to do it manually, because it is a very long-winded job to be able to do that manually.
Sonia, I think that's very helpful. So really, it sounds as though it would be advisable for practices to contact Accurate.
Yes, and cancel basically all the patients in the previous search, and then rerun the new search, and then upload it again.
Okay, thank you.
And anyone who's already gone through, I'm afraid that unless, you know, Amaya or anyone else contacts you directly and tells you that the wrong patient has been booked in, because they check the AccuBook anyway, so they would let practices know regardless if there's a wrong patient booked in or if they don't qualify.
We're not checking actively. Sorry, so Claire again. I had to go for. I'm on site, so I had to rush off to reception for something. I'm back. We're not checking actively because when we do look at AccuBook, we can see which practices are booking in patients, and we can see the ages of the patients, but we don't have access to EMIS to say if that patient has, you know, falls under the correct category. So it does fall back to patients. Some patients have slipped through the net today. There's nothing we can do about that. It's not until they get to sit in front of the vaccinator that we realise that they were identified incorrectly by the Group 6 search. So I think what somebody's saying about, can we have a search to work out the difference between the old Group 6 search and the new Group 6 search, and see which patients aren't in the new Group 6 search. Maybe those invites could be cancelled manually. I don't know what the easiest way is.
Or Sonia was saying, Claire, you know, we just, you know, practices contact Accurix and say, were you there for when Sonia was describing it?
Not fully, but don't worry going back.
Okay.
If they can help.
If they can help, yes. Mandy, do you want to have a come in again?
Yeah, sorry, just because Claire's back, I just wondered what the guidance was from kind of you guys about coding the invites retrospectively. I mean, I'm guessing that if we've invited patients and they've actually taken up the offer of the vaccination, we don't need to worry about that. But any patients that we're sort of contacting for the second or third time, now that we've actually got the CG template, which I have to say is incredibly helpful, do you want us to retrospectively go back and try and code those with a relevant date, Claire?
We'll have to take it to the ops group, but I think, you know, if they've been vaccinated, then that's job done, isn't it?
Yeah,
really, we don't need to be coding that, but we do have to make sure that we have made every effort. And as Joe said, at least one of those has to be by telephone for the ones that haven't engaged and haven't declined or haven't deferred, because we don't want to miss patients out because, you know, some of them may have an incorrect mobile number. We can't just assume that sending them a text means that they think they've been invited. Also, the link for these things, for the appointments, don't work on non-smartphones. They don't work on the old brick telephones.
Yeah,
so
no,
it's about contacting those patients.
Yeah, no, it wasn't about the patients that have been invited and have taken up the offer of booking an appointment. I think, you know, those are gone.
Yeah,
it's mainly, I mean, we have a small cohort of patients probably from each of the groups, apart from probably groups 5 and 6 at the moment, a small group who we're actively going back trying to contact by phone. As I mean, they may well have had text. They may well have. We may be well on the way to 3 telephone contacts with them. But just wondered, in terms of completeness, assuming that they haven't taken up the offer at the moment, and they may not take up the offer, whether you want us to retrospectively go back and try and code those on the template so we've got that information readily available.
We'll check and put it in the bulletin, Mandy, because it depends how big a job it is for practices.
Yeah.
Some practices have done that disclaimer, haven't they, and submitted it sooner, saying we've made contact 3 times. So that's what we'll use, but we'll confirm in the bulletin tomorrow.
The only other question I had, it was something that I did try and raise with Taz, but I haven't managed to kind of come back to her on it. I don't know whether AccuBooks is changed since, but certainly when we were going through trying to clean our sort of invites up about a week, 10 days ago, what I did realise was that if you cancel an appointment, it appeared to take that invite out of the EMIS record for the patient.
Okay, I wasn't aware of that. AccuBook have got a very good chat function. So I think just try the instant chat messaging. I don't know if other people have experienced that as well. Again, I can ask, but I'm not sure if I'll get an answer.
Yeah, I mean, I did leave a message for Taz because I just wanted to clarify that. And also when we were sending, using the reminder function in AccuBooks at the time, and again, I know they're really doing extremely well in trying to kind of update the software. But when we sent a reminder, the reminder wasn't being coded in EMIS. So again, we were just a little bit concerned that if we were asked for evidence of 3 appointments, it wouldn't be there. However, having said that, I mean, obviously now we've actually got the template, it will make things a little bit easier, although I'm just a bit concerned about the numbers that we've got in the current cohorts, that's all.
Andy, is that the number you've got in the current cohort 6? Have you run that search yet? The new?
I ran it, and I'm just running the version 8 now. Okay,
yes, because it would be very interesting to know what the difference is that you're seeing. They will be much lower.
Yeah. I think the problem is, Joe, as probably a lot of other practices have found, these searches can take forever to run. I mean, my cohort 6, I started it, I think, I either started it sort of Sunday evening or Monday morning. It didn't finish running until late yesterday. By the time my search had run, and I tried to upload it, there were no appointments left. So the searches are just taking forever. And I'm not saying that's a CEG problem. I think that's an EMIS problem, because we have the same whatever searches we tend to run. So sometimes it can take 1 or 2 days for them to actually finish.
Yes, yeah, Amanda, I know. I mean, that is a EMIS. It's an EMIS problem, which we all sit with and watching searches queuing. Sadly, I have no answer to that one. There was another question, I think, in the chat about a letter from Denise, I think. Is there an invite letter and a CEG letter for patients on the LD register that would be helpful to have, that we've not been able to contact on the phone? Have on the template.
No, there is one. There's a letter on for patients with learning disabilities, and an information leaflet that we have used or plugged out. I was just wondering if we could have that attached to the
template.
Yeah, either the template. That would be helpful. And I think it was one of the CCG comms maybe last week or the week before. And there's also, and then whether or not there's a sort of a national letter we can have on one of your templates, so that we can, for patients, we were doing the 2 or 3 invites or by phone, and you still fail either because of not an updated phone, or that we could send letters then to a certain number. It wouldn't be many, but those that in terms of phone contact. So I was just wondering.
We can look at that. Yes, we can attach something to the template if you can forward it to us, and then we could attach it. Okay, is there anything else? Any other questions? Have I missed anything? Or Keith or Anna, do you want to add anything?
No, but we might get in touch with Sonia with her experiences of Accurix and Accubuch. If that's okay, Sonia? Maybe she's gone.
Oh, I think all it is that if you've got an issue with bulk removing, you have to contact Accurix directly. That's the message really, and they will do it for you or tell you how to do it.
Okay, thank you everyone for giving up your time, and it was great to see some familiar faces. So thank you so much. And as I said, please, you know, contact us if there's any issues, and always contact Lewis, who'd be only too happy to help you with the stuff as well. So thank you very much for your time, and good luck with cohort 6.
Thank you.
Bye.